Hello, my name is Professor Vivian Milch and I'm the Medical Director at Cancer Australia. I'd really like to start by thanking the Chinese Anti-Cancer Association Australia for the opportunity to present to you today, and I'm going to be talking to you about the National Lung Cancer Screening Program. It's a great opportunity to have a webinar that's focused on lung cancer prevention and early detection and treatment, with a special emphasis on talking and promoting the new lung cancer screening program in Australia. I'd also like to acknowledge the traditional owners of the lands that I'm joining you from. It's the Gadigal people of the Eora Nation, and I'd like to pay my respects to any Aboriginal and Torres Strait Islander people who are joining us here today. The National Lung Cancer Screening Program was announced in the 2023-24 budget. The government committed $263.8 million to establish a new national lung cancer screening program. It's the first new screening program in 20 years, and we have a real opportunity right now to improve the outcomes of lung cancer. So why are we worried about lung cancer? Well, in Australia, lung cancer is the leading cause of cancer death. It's a cancer that starts in the lungs, where you have a small group of cells that are not normal that grow out of control and can then spread to the other parts of the body. Cigarette smoking is the biggest risk factor for lung cancer, but if found early, lung cancer cases can be treated successfully. So we have established the National Lung Cancer Screening Program to improve outcomes by finding lung cancer early and therefore reducing deaths through early detection. There are really effective treatments if we find lung cancer early, and it can be managed well and effectively. Just like the other screening programs, we're looking for signs of cancer before you develop any symptoms. And then the goal is to find it early and treat it. And it's estimated that we will save hundreds of lives every year through lung cancer screening. So who is eligible to take part? Well, this is a 2-yearly screening program. It's a screening program using a low-dose CT scan, which is free. And it is used every 2 years for people who are 50 to 70 years old, who are either currently smoking or who have smoked in the past. And if they've given up, that they've given up 10 years or less ago. That those people have what we call a 30-pack year history of smoking. And your GP can help you calculate what does the 30-pack years mean. But if you do think you're eligible, go to see your GP and they can help you work this out. The other thing that's important is that the person has no symptoms or signs suggestive of lung cancer. But once again, if you're worried that you might have one of those symptoms, you need to go to see your GP and talk about it. The program will start on the 1st of July this year, so discuss with your doctor from that date onwards. So the Department of Health and Aged Care is leading the implementation of this program and has done that in partnership with the National Aboriginal Community Controlled Health Organisations, NACCHO, and Cancer Australia. And we're also working with experts right across the field to support the participants and healthcare professionals in bringing in this new program. So what does it look like? Bottom line is that the first thing you will find over time is that you will hear a lot about it, and there's going to be program promotion that will be starting after the 1st of July. At that time, what we're encouraging people to do is to go to your GP or your healthcare provider and discuss whether you might be eligible. The second thing that will happen is that the GP will check eligibility, and they will start by working out whether you're in the right age group, whether you whether you're currently smoking or whether you used to smoke, and whether you have any other symptoms or signs of lung cancer that maybe you might be able to be investigated for in a different way. At that time, the GP will work with you to make a decision to participate in the lung cancer screening program and will order a low-dose CT scan. That will involve the GP giving you a form to take to your local radiologist. I will talk in a minute about what happens if you live in a rural or remote area, because we will be having mobile lung cancer screening vans. When you get the results from the screening program, they will actually be given to both you and to your GP, and your GP will be able to manage your results and any findings on the CT scan. The actual CT scan is very easy. You lie on a table for 5 to 10 minutes. It's not painful. You don't need any needles, and it's a very simple and quick procedure. The radiologist then reviews the images and looks for what we call nodules or little lumps in the lung that might indicate that there is an early lung cancer there. I mentioned before that for some people who live in the country areas, there might be ability to have scanning through a mobile screening truck. So at the moment, all the CT scans will be done through local private and public CT infrastructure. But people living in rural and remote areas might live a long way away from a local CT scanner. So we are building 5 mobile screening trucks that are being manufactured to deliver mobile screening services for some areas of rural and remote Australia. The work, including where the trucks go, is being co-designed with NACHO to ensure that it is fit for purpose, and also with the jurisdictional health departments. There are also going to be 2 new MBS items to pay for the CT scan. So I mentioned before that they're free, and that is because they are funded by the government, and they are what we call mandatory bulk billing, which is when you go to the radiologist and that scan is billed for without any out-of-pocket cost from you. There is 2 MBS items. There's one to be done every 2 years when you participate in the program, and then there's also another MBS item for if there's any follow-up required because of any abnormality that is seen on the scan. The other thing that's important to know is that there's a National Cancer Screening Register. That's the same register that looks after the bowel cancer and cervical screening programs, and it'll also look after the lung cancer screening program. After you've started participating in the lung cancer screening program, the register will send you further invitations and will send you communication, including results, and you'll be able to go online and actually access your history. It will also report on the program, and it will also connect health professionals with their results and with their screening history. We've also developed a whole lot of program materials and resources, and you will be able to see these through your GP or on the Lung Foundation website. At the moment, these are being translated into Mandarin so that they will be accessible for you, and also into a number of other languages. There are a number of things that will happen over the next couple of months leading up to the 1st of July. One of those is we'll have a national communications campaign. We'll be talking to a lot of people, including the various people in the health sector, clinicians and patients and community over the next little while. There's also a web page on the Department of Health and Aged Care website that you can go to read about the program. And here is a QR code and also the link of that website, so you can go and read more about the program here. If there's any questions, please email us on lungcancerscreening@health.gov.au, and we will be able to help you out. We're looking forward to the beginning of this very important program as we really tackle lung cancer and help people be diagnosed early and improve outcomes from this awful disease. Thank you so much.